Hello everyone, my name is Megan Ambrose, and I will be presenting Leininger's Cultural Care Diversity and Universality Theory. Cultural care theory, what is the purpose? So in this slide, this is just a pictorial representation of two major concepts of health outcomes and cultural care, and how these two converging concepts make up cultural care theory. The goal of the theory is to provide culturally congruent care to diverse populations, generating knowledge on the cultural influences on health and illness as it relates to nursing care. When cultural congruency exists, health outcomes are better. The major concepts of this theory are cultural care, diversities, and universalities. And then the theory incorporates an emic and an etic view. The emic view is the language, perception, beliefs within a culture, and the etic view is the outsider's view of the culture itself, which is quite often the healthcare provider's views of the culture based on a specific phenomena. The major concepts of cultural care theory are the existence of social and cultural factors influence the human being and therefore affect care processes. Nursing care is tailored to incorporate family experiences, sociocultural aspects of the family, and personal nursing experiences with the culture. And finally, cultural preservation, cultural care accommodation, and cultural care repatterning are fundamental to culturally friendly care. What is culture? Culture encompasses race, ethnicity, gender, religion, or any social affiliations. As nurses, we must recognize language, group identification, and socioeconomic factors as other important aspects of culture. The values, knowledge, beliefs, and attitudes regarding one's culture is shaped socially through group interactions as this develops one's identity. And the term cultural competence is now an antiquated term, as we have now recognized that we can never measure competency for a culture that we don't personally practice. Culture is an individual's perspective, therefore the journey of cultural understanding and learning is now referred to as cultural humility. The goal is to acknowledge variations within and also among different cultures and use this newly generated knowledge in clinical practice. The healthcare provider must recognize one's own biases regarding certain culture before they can move to a state of cultural humility, which is a lifelong engagement of learning and developing understanding of how specific cultures benefit, and developing an understanding of how specific cultures benefit health and improve outcomes. Cultural care is also meaningful, desired by, and congruent with the values, beliefs, and practices of the patient. Leininger's cultural care model is depicted in this diagram and states nurses cannot separate worldviews, social structures, and cultural beliefs or practices from health, wellness, illness, or care, as these factors are closely linked and interrelated. Cultural and social structure factors such as technology, religion, family and kinship, politics, cultural beliefs and practices, economics, physical conditions, and biological factors are significant forces affecting care and influencing health and wellness patterns, and as well as well-being. Leininger's cultural care theory identifies three modes or ways to provide culturally congruent care when treating illness, whether it is an inpatient or in a community setting. The first mode that I personally feel is the starting point is cultural care preservation. Cultural care preservation refers to facilitating actions to maintain beliefs and values during times of illness or dying. You begin with a cultural assessment on admission, acknowledge similarities between and within cultures, and respect differences that may differ from the nurse's previous experiences with the culture. This generates new knowledge about the culture, and one should not assume similarities exist within the culture. Cultural care accommodation refers to the adaptation or negotiation for culturally congruent care to provide effective care delivery to promote health, well-being, or address illness. Examples include adjusting provider rounding to accommodate prayer times, adjusting med times for fasting, providing same-gender nurses, dietary needs, and limiting certain treatments not recognized by certain religions. And then finally, cultural care restructuring refers to facilitating professional mutual decisions and actions that help peers and institutions modify care for better care to benefit the health outcomes. Instigating change through awareness and addressing any discrimination. This is the area in which a nurse becomes the change agent for improving nursing practice. The scope and level of the theory, it is derived from anthropology, and it's a middle range theory. What are the central tenets of cultural care theory? Nurses must understand the individual's view of illness. Nurses must recognize cultural similarities and differences and apply the newly generated knowledge to positively influence nursing care and health. And the theory is applicable to many areas in nursing whenever engaging individuals, families from diverse populations. Cultural care is an integral part of health management, as personal beliefs regarding health, treatment, maintenance, and feasibility of care processes are valued by the patient. Incongruencies interfere with outcomes, creating conflict and mistrust. Leininger's cultural care diversity and universality serves as the foundation for establishing the nurse-patient relationship in care planning and suitable to the needs of the patient. Care planning is not a one-size-fits-all model. It is individualistic, with many external factors that need consideration in order to make the patient whole. The theory and model successfully addresses the cultural implications associated with health problems, such as beliefs on healing, medications, diet, and even language barriers that may impact health literacy and follow-up with medical providers. Cultural care may be generic, consisting of culturally learned traditional approaches, so what we think we know about a culture, or it may be professional care, which refers to formally learned knowledge combined with formal education on culture care in professional health settings. The phenomena of interest is health literacy as it relates to limited English language proficiency. Leininger's cultural care theory supports this phenomena by recognizing the need to provide culturally congruent care creatively so that the culture is preserved, care and health education is negotiated safely, and awareness is raised about the global concern of health literacy and chronic illness for individuals with limited English language proficiencies. Racial and ethnic minorities are more likely to have lower levels of literacy, often due to cultural and language barriers and differing educational opportunities. The U.S. Department of Education reports only 12% of English-speaking adults in the United States have proficient health literacy skills, and approximately 45% of high school graduates in the United States have limited health literacy. Healthcare decisions are hindered when health literacy gaps exist, and when gaps in communication between the patients, families, and healthcare team members exist. Lack of English language proficiency impairs a patient's ability to access health information, resources, communicate healthcare needs, and understand health information. With an increasingly diverse and aging population, health literacy challenges are going to continue. Low literacy may affect patients' ability to read and understand the instructions on prescription or medicine bottles, health education materials, and even insurance forms. Language and communication barriers can affect the amount and quality of healthcare delivered. The type of interpretation service provided to patients is an important factor for patient satisfaction. And patients who use family interpreters or non-professional interpreters, such as nurses, clerks, and techs, are less satisfied with their visit. What does the literature say? In this study, and excuse me, I don't know how to say that last name properly. But in this study, the researchers explored factors that influence nurse-to-parent communication in the provision of culturally sensitive pediatric care. Barriers that were identified are organizational factors and human factors. So from the organizational factors standpoint, lack of definitive policies for delivering cultural health care and insufficient cultural health care education were the organizational factors that were identified as obstacles to effective communication and health literacy. Human factors were nurse-related and also unique to the family. Nurse interest in establishing a relationship with effective communication varied. Committed nurses tried to establish a sincere communication with the parents through different strategies, but the disinterested nurses focused on fulfilling orders rather than ensuring patients were informed. Effective communication with the patients and families of culturally diverse patients occurred when the nurse shared the same cultural background. Patients who spoke a non-dominant language, effective communication occurred if the nurses used the parents or a third party, which would be like a colleague. And this helped with the language barrier. In cases where there was no way to communicate, the nurses used body language and physical behaviors to convey their instructions. Parents' level of knowledge and their personal health literacy influenced the communication process. In another study, Zhao 2017, in this study, the phenomenon of interest is dietary behavior and blood pressure control in Chinese immigrant populations with English language communication barriers. Health literacy barriers include lack of knowledge in navigating the Western healthcare system, difficulty making appointments, accessing care, not understanding what personal information needs to be disclosed with healthcare providers, and unfamiliarity with the different healthcare team roles. In the Patel study, Patel 2021, the researchers investigated the nurses' experiences with self-care practices for heart failure in migrant populations, and self-care counseling was the intervention for this study. Researchers reported difficulty in applying the person-centered approach to health literacy with this population, as this practice is uncommon in many countries. Migrants viewed nurses as incompetent when they tried to use this approach and unknowledgeable about the illness when attempting to include them in the care. Health literacy topics were prioritized due to the language barrier, and creative strategies were used to educate the patients on heart failure, such as mapping and drawing pictures to convey messages. Telephone follow-ups, teach-back, and reflection were other creative strategies. Cultural care and Leininger's cultural care diversity and universality theory is relevant to many areas of nursing, such as practice, patient care, education, administration, and research. For nursing practice, implications of providing culturally congruent care to the nurse-patient relationship, establishing trust and care planning based on individual needs as opposed to the culture. Care planning, discharge processes, and home management of chronic health conditions must not neglect the human being and how sociocultural factors shape the individual. Patient care is altered based on the individual needs, but this also requires commitment from the nurse and other health professionals aspect. Pharmacological management may need to be revised, altered, or even neglected based on the patient's beliefs. Nursing education on cultural care must start early at the pre-licensure level, requiring curriculum revision and addressing the phenomena through simulation if in-person clinical does not provide this learning opportunity. And then once they're fully licensed, nurses must receive cultural humility training, but also have the tools to practice this in the clinical setting. Nursing administration must think of cultural care and culture from a unit culture standpoint. Effective teams are diverse, and thus varied beliefs and experiences shape new ideas from diverse collaboration. And nursing research has widely used the cultural care model. There does appear to be some limited evidence of how cultural care directly affects health outcomes. My literature search did not produce strong evidence on this. However, research in this phenomena brings a greater understanding of disparities. Nursing as the change agent. The cultural care theory explains health literacy, language barriers, and patient dissatisfaction. The framework guides culturally congruent care and is suitable to address health literacy due to communication barriers. Some low-cost interventions to improve health literacy for English language proficiency as a nursing project would include communication boards, iPad apps, discharge instructions in patient-preferred languages, and teach-back technology for discharge education. And another example would be recorded discharge instructions using the patient's preferred language. And these are my references for this presentation. Thank you.